everyone. Welcome to This Day. It is Thursday, October 22nd. Now we have a couple meetings to tell you about today. The first one is the GRF agenda prep, and that will be at 9:30 this morning. And then we also have the town hall meeting, which will be live at 9:30 this morning, following our morning broadcast of This Day. All right, on our show today, we have OC Eye Care, and we talk about a lot of different types of surgeries that they do. Most are in-house or in their offices, so we're going to talk about that. And then we also have MemorialCare because open enrollment is right now. Let's go ahead and give you our resources that we normally do. We have the we have covid19.ca.gov, ochealthinfo.com, and then there is a hotline, 714-834-2000. Then, of course, you can go to our website, which is lagunawoodsvillagealerts.com, and you can email us at info@lagunawoodsvillage.com. Weather is looking quite lovely. It was actually very nice this morning for a nice little walk with the dog, nice and cool. And we do have some overcast, so that will burn off later, and it will be a lovely 74 today, overnight 63. And then again on Friday, we're looking at 74. Saturday, 72. Sunday, cooler, 69, 54, and then Monday, it's going to be a nice Monday, 73, 54. Our sunrise this morning was 7:02, and the sunset will be 6:08. Now, look at all of those pumpkins. I know it's not an animal, but nonetheless, I thought that was really a great picture. So, Bob, thanks so much for sending that in. I appreciate that. And if you have a photo that you would like to share, and it's okay, if it's Halloween related, definitely send it in. I'd love to see some fun costumes. Maybe you dress up your animals. Send in a fun photo of your animal maybe dressed up. Whatever you send it to lagunawoodsvillagetv@gmail.com. All right, when we return, we will have OC Eye Care. Stay tuned.
As a friendly reminder, cast your third mutual ballot by using a dark pen to fill in the oval. Place your ballot in the secret ballot envelope. Then, insert into the yellow postage-paid return envelope and seal. On the back of the yellow envelope, sign your name. Mail in plenty of time to arrive before November 2nd. Or hand deliver to the community center ballot box by November 2nd. This is an important election proposition. Please vote.
Welcome back. Well, today I am joined by Kunal Kumar Vyas, who is here from OC Eye Care. Well, welcome. How are you?
Doing well. How are you?
Good, good. Well, we haven't heard much about OC Eye Care, so I'm really glad that you were able to join us and give us a background on what you guys are all about. So tell me a little bit about your practice.
Right. So we are a comprehensive ophthalmology practice. We're right in the backyard of Laguna Woods, kind of right in that community center location. Mm-hmm. And we basically take care of everything eye related.
Okay. So now, have you been there long?
We've been here for about a year now. So we're coming into our second year at this point. Yeah.
Oh, that's great. And how many rooms do you have where you can see people?
We have 3 exam rooms, and then on top of that, we have a special testing room as well, where we have all the equipment on site, from anything from glasses to advanced cataract surgery, glaucoma surgery, wow, laser retina surgery, kind of everything in one place.
Wow, sort of a one-stop shop for everything that you might need. That's awesome. So let's talk a little about some of the cataract surgery that you do.
Sure. So some of the cataract surgery that we do, well, there's different types. So I have some props actually I could show you a little bit about what we do in terms of cataract surgery. So cataract surgery is basically the replacement of your natural lens with a synthetic lens. And it happens typically in our 60s, 70s, in that time frame. And what we do is we basically take out the natural lens and we put in its place a synthetic lens that looks something like this. Mm-hmm. And there's various different types of lenses, okay? So your basic monofocal lens that looks something like this really just gives you one focal point either in the distance or in near. And that's kind of the standard thing that's done these days. But we also do premium cataract surgeries. So we do things that will correct your eye so that you don't need any glasses for distance or near. And that type of lens implant looks something like this, a little bit different. I'm not sure if you can see
Yeah.
all the little rings in there,
Yes.
but all those little rings help you focus at different focal points, kind of like the natural lens when we were in our 20s. So that's some of the cataract things that we offer. We also offer laser cataract surgery and something called Verify, where while we are doing the cataract surgery, we can make sure that you'll be seeing well the next day.
Oh, wow. That's great. And is that last one you mentioned something that has only been around for a little while?
Yeah, so Verify and the LensX laser, those things are fairly new. I'd say probably around 5 years or so they've been on the market and out and about. And it's something that the newer surgeons are more comfortable using typically.
Right, I would imagine. And then, so the technology, what are the advantages with this technology?
Great, yeah, so lots of great advantages. So some advantages are, again, you can make intraoperative, so second by second adjustments while in surgery. So you can, take your pre-surgical data and adjust real time to anything that's happening inside the eye in the OR. That's one great advantage.
Okay.
And then another great advantage is the laser cataract surgery. Sometimes if we have a really, really, really thick cataract that might be difficult to take out, we can kind of break it up beforehand and make it so that the patient heals quicker, sees better faster.
Wow. Okay. That's awesome. And then you also do microscopic glaucoma surgery. Tell me what that is.
Yeah. So for patients who have glaucoma, it's typically like a pressure mismatch in the eye that causes, some peripheral vision damage. Mm-hmm. And for those types of patients, they're usually on drops to begin with, but as they progress, sometimes they need some surgery to help bring that pressure down.
Right.
And so I do something called microscopic implantable glaucoma surgery, where we use, I have a little model here I can show you. We use this very, very tiny, tiny blade. And we do this either during cataract surgery or it can be done on its own. So it can be done as a combo. And I'm not sure, let's see if you can see this thing.
Oh, yeah.
Real tiny, real tiny. But that little blade, what it does is unroofs the drainage system of the eye so that the eye's fluid doesn't build up pressure. So here's another kind of representation. This is a close-up of what that looks like. And this thing just kind of unroofs the surface of the drainage system.
Oh, okay. All right.
Now, these surgeries are brand new. And so the biggest benefit is patients have drop in pressure. They sometimes get off of their pressure drop, so they don't have to keep taking drops all the time. Mm-hmm. And they heal much quicker. So lots of advantages to that type of surgery.
Wow, that is great. I mean, technology is moving pretty fast in all facets of the medical world, and certainly our eyes are not left out, are they? So that's awesome. Good stuff. It's nice to know that you're able to administer these new technologies, because like you said, some surgeons who may have been around for a while are not comfortable with that, and they're still doing the old ways. And obviously some of the advantages here are recovery times, which must be really great for people.
Of course, yeah, recovery times is the biggest thing. So aside from recovery times, it's also the percentage of patients that respond to these procedures is far higher, especially when it comes to uncontrollable glaucomas. Things of the past, they're a little more invasive, a little bigger devices, and so it's harder to heal from them. So a huge thing is that they don't work all the time either, the older devices. So these devices almost, they're approaching 100% success rate. They're very, very successful in their outcomes.
Is that also true for the elderly? I mean, obviously, I don't think you have to deal with most of these things until, the age of over 50?
Typically, yeah, typically. Now some children do get glaucoma and cataracts, but typically it's in the older populations, yes.
So sometimes we look at ourselves and we say, okay, if we're over 50, our recovery times from injury might not be so great. But you're not really finding that with these types of
No. So here's examples today. I just did a surgery yesterday. The patient today is 20/20, pressure is perfect, and so the recovery is literally next day.
Well, that's exciting. I mean, I had LASIK all those years ago, and man, they sat me up on that table and I saw so far away, I couldn't believe it. So, it's really refreshing, when you can go right back to living the way you always used to know.
Exactly. Most of the patients are driving to their appointment the next day from not being able to see for years.
They must be so happy.
They're ecstatic.
All right. So one last thing, you have diabetic eye disease. I didn't even know there was such a thing.
Yeah, so diabetes is probably one of the most common things that affects the eyes. It really causes havoc, especially in the back part of the eye, in the retina. Oh. And I think of the retina as like the film. If you don't have a good film in a camera, you're never going to get a picture. Mm-hmm. And so the diabetes really affects that retinal layer. And in order to keep that healthy, it's very important for diabetics to get their eyes examined to make sure there's no bleeding or swelling in the most sensitive parts of the eye. And so we do take care of that. Not only do we examine those patients, we have the specialized equipment called an OCT that takes microscopic imaging to make sure there's no swelling in certain sensitive areas. Mm-hmm. And then we also have the laser that would help treat those things in case there was any necessary treatment needed. And we also do the injections that would get rid of the swelling if there was some there as well.
Oh, and now tell me about the lasers. What kind of lasers are you using for this type of issue?
Sure. So this type of laser is called a pan-retinal photocoagulation laser, kind of a long thing. A short word for it is PRP. But that sort of laser, what it does is the process of diabetes causes faulty or leaky blood vessels in the back of the eye. And so what that laser does is basically close those blood vessels so they stop leaking. That's typically the purpose of that laser, yeah.
Is it like a cauterization?
Kind of.
Okay.
That's a good way of thinking about it, yeah.
Well, yeah, I mean, because if you're going to be going after the vessels, then that's the only way I could think of it, as a stopping them from bleeding. So how long does something like that last?
How long does the treatment last? Or
Yes.
Oh, so the treatment periods typically take about 15 minutes for the lasers. The injections are far less. The injection, it's just in and out. It's
right.
More of the time is prepping the patient, making sure they're numb and comfortable.
And then how long, like thereafter, does somebody have to come back soon to have it done again?
Oh, that depends on the level of disease. So it's kind of all variable. Sometimes no, sometimes yes. It really just depends on how much of the eye is involved, how much laser is needed.
Okay. All right, perfect. Anything else you'd like to let our residents know?
The only other thing I like to let them know is that we are a boutique practice. And so what that means is you will see me every time you come here. There's no shuffling around to other doctors. You always see me. The other thing is your time is your time. So, there's no waiting, long waits, all that sort of stuff. And the other thing is I take as much time as we need to handle whatever questions my patients have. So that's kind of the crux. And I think that's really important in the patient-physician relationship.
Exactly. And you guys are open now, I understand, and you have been through COVID-19.
We are open through, I'm not wearing my N95 right now for the interview, but typically we're fully masked up, gloved up. We actually have reduced scheduling during COVID. We only allow 5 patients because we want to make sure that the rooms are clean before and after. Okay. And we also screen patients prior to them making and coming for their appointment.
All right. Well, thank you so much for taking the time. It was very nice to meet you.
You too. Thank you for having me.
All right. And we'll be right back after this.
Get your vote by mail ballot.
You can stay healthy and fill it out from the safety of home.
Or you can fill it out anywhere.
It's easy to mail back. You don't even need a stamp.
Or you could use an official drop box.
You can even drop it off at the polls.
Then track it to confirm your county got it. See, they got it.
Mail ballots are the simple, safe, and secure way to ensure that your vote is counted.
Hello everyone, and thank you for joining us on today's program. My name is Jose Juarez. I'm the Medicare Education Specialist at MemorialCare Medical Group. On today's program, I'll be covering the basics of Medicare and open enrollment. Before I get started, let me tell you a little bit more about MemorialCare. MemorialCare is one of the largest and top leading medical groups in Orange County, with top leading physicians and top rated hospitals like Saddleback Memorial Medical Center. So what sets us apart from other medical groups? Well, most of our locations offer lab and x-rays. We have an open network where you can see any primary care physician within the MemorialCare network. You have a patient portal, MyChart. This allows you to reschedule appointments, order prescription refills, and have constant communication with your doctor. And you have me as your personal representative. If you have any questions, concerns, issues, you can call me, text me, or email me. Now let's get started on Medicare. What is Medicare? Medicare is a federal insurance program for people 65 and older and others who have a qualifying disability. You have to be a U.S. citizen or a permanent legal resident. So here are the ABCs of Medicare. Medicare is made up of two parts. You have your Part A and your Part B, often called Original Medicare or Traditional Medicare. You also have Part C and D, Medicare Supplement Insurance, where I'll cover at a later time. Your Part A, this is your hospital insurance. This covers your inpatient hospital stay, skilled nursing facility, hospice care, and some home health care. So Part A, and what does it cost you? Part A is a premium-free for most people. If you and your spouse have worked for about 10 years, that equals to 40 credits. Other costs for Part A may include deductibles, co-pays, co-insurance. Co-insurance may apply only when you receive services. Your Part B, your medical insurance. What does it cover you? This covers your doctor visits, outpatient services, medical supplies, and preventative care. Part B, what does it cost you? Almost everyone will pay a monthly premium of $148.50 in 2021. If you pay into Social Security, the premium is automatically deducted every month, or you can pay directly into Social Security quarterly. Other costs for Part B may include copay, deductible, and co-insurance. You pay 20%, and Medicare pays 80% of approved charges. So what's not covered? Your dental care, eyeglasses, hearing aids, and cosmetic surgery. What's Part C? Your Medicare Advantage plans, your HMOs. Most all plans are premium-free. This is all-in-one alternative to Original Medicare. You must use HMO doctors and facilities. You have a gatekeeper, your primary care physician. Most plans include prescription drug plan. Additional benefits include dental, vision, gym membership, over-the-counter benefit, transportation, and worldwide coverage. You have your Part D. Part D plans come in two different forms. You have your prescription drug plans, your PDPs. These plans are sold as standalone policies by various companies, and copays and premiums vary. Then you have your Medicare Advantage drug plans, MAPD. Most HMO plans include Part D at no extra charge. And there's Medicare Supplement Insurance, your Medigap, which supplements Medicare. This helps pay out-of-pocket expenses. It comes in standardized formats. The premiums vary depending on your current age at issue, and by the county and state that you reside in. So when do you enroll for Medicare? You have 3 months before your birthday, the month of your birthday, or 3 months after your birthday. Then you have a special enrollment period. When you lose comparable coverage, move to a different county or state, you have 63 days to notify Medicare that you moved. And then annual election period. This is the most important time to apply for Medicare or make any changes on your current Medicare plan. And this is from October 15th through December 7th. During the annual election period, you're able to make an annual notice of change. You may join, switch, or drop the Part C plan, or you may join, switch, drop the Part D plan. Or you may purchase a Medigap supplement insurance plan. Please keep in mind, there are penalties for late enrollment, like a 10% per month penalty on your premium if you sign up late, unless you didn't sign up because you already had coverage. And once you choose a program, you are locked into that program for 1 year. And for you, MemorialCare now has a dedicated phone line available exclusively for Laguna Woods residents. The 24/7 phone line is staffed by a concierge team at our navigation center who's ready to assist residents with their healthcare needs. We now have a new medical office conveniently located in the Willow Tree Shopping Center on El Toro and Moulton. And this is easily accessible utilizing the Laguna Woods Village transportation services. Here at MemorialCare, your health is our priority. This year we're offering virtual Medicare seminars during open enrollment. We'll also be offering face-to-face meetings. Social distancing will be enforced and we'll be providing face masks and hand sanitizers to participants. Seating will be limited, so please visit our website, memorialcare.org, to view a list of our virtual and face-to-face meetings. If you have additional questions, please find my contact information on the screen. I've also included other helpful links and phone numbers that you will find helpful. Thank you everyone for joining us on today's program. I hope you found this presentation helpful and useful. And remember, MemorialCare is here to help you.
Today, patients have many options for their care, whether it's their private doctor, in urgent care, retail clinics, nursing advice lines, and even telemedicine. So while patients do have many options for their medical problems today, some conditions, such as heart attack, stroke, and sepsis, truly need immediate care in the emergency department. Every minute does count. We're here ready to help 24/7, 365 days a year at MemorialCare Saddleback Medical Center Emergency Department.
Cups, plates, burgers, chips, masks, outdoor air, 6 feet of distance, as few people as possible, and plenty of hand soap. Make sure lowering the risk of spreading COVID-19 is on your list for your next small gathering.
Do your part to lower the risk.
People with hearing loss only know the way they hear, not how much better they should be hearing. How well are you hearing? Are you understanding 60% or maybe only 30%? You don't know unless someone measures your hearing understanding ability. People are wearing hearing aids that are underfit with power, not programmed properly, the physical fit is too loose or too tight. Find out what your understanding score is with a special word test from Advanced Ear Care. Stop in today and tell them Stuart sent you.
Welcome back. Well, we have a few things to tell you about. Of course, the most important one is today, this morning at 9:30 in the morning, we are going to air live the town hall meeting that is put on by Third Mutual. And you can follow along right here on Channel 6, or of course you could always go to Laguna Woods Village, lagunawoodsvillage.com/meetings. They ask that you can text 949-354-4199 if you have specific questions. Please provide the CC&R page number or section citation if your question is regarding that in particular thing. But take a look at that coming up here at 9:30. Now this weekend on Saturday is the National Prescription Medication Take Back Day, and that is put on by the City of Laguna Woods, Orange County Sheriff's Department, and the Drug Enforcement Administration. It'll be from 10 a.m. to 2 p.m. and it'll be at Laguna Woods City Hall. It's right there on El Toro Road. And they're asking that you bring the unwanted, unused, and expired prescription medication, and they will not ask you any questions. You just hand it over and be on your way. They ask that you do not bring sharps, marijuana, or any pressure canisters. If you have any questions at all, you can call 714-647-4133. All right, then we've got another drive-through event that's being put on by AgeWell Senior Services. The Florence Sylvester Senior Center is putting on a drive-through flu shot clinic next week, and we will have more information about that, but Nonetheless, here it is, 1 to 3 p.m. If your last name begins with A through M, you want to go from 1 to 2, and from 2 to 3, they're taking people from, your last name is N through Z. Fun, fun, fun. Halloween golf cart parade. Love it. What a great way. Look at these cute ideas. They've got Fred Flintstone on the left, and then we've got the Jurassic Park one on the right, of course. These do take some time to participate, but nonetheless, I love it. Really fun. Saturday, October 31st at 10 a.m. To participate, you do need to go to the Laguna Woods Village website, go to amenities and recreation. Well, just another reminder, I know that we just showed you an open enrollment from MemorialCare, but definitely is the time now to take into consideration your Medicare plan, and it can be very confusing. But the Health Insurance Counseling and Advocacy Program is here to help you save money, help you with your choices, explore the different options that are available to you, and they will prepare a free customized plan. You can call 714-619-4361, or you could visit them at coasc.org/HICAPAEP. So some really good stuff there for you. And then lastly, you know, your ballot drop box is right here. And we've got one at the El Toro, at the City Hall on El Toro Road, November 3rd, 7 a.m. to 8 p.m. It does open October 30th through November 2nd, so you might have to wait a little bit to get that in. But you can drop them off morning or night through November 3rd. All right, let's take a look at our weather one last time. As I mentioned, it is going to be a lovely day. Temperatures as soon as our fog burns off. I would imagine around midday we're looking at 74 for the next couple of days, and then we drop down to 72 and 69 over the weekend. And then we are heading back up just slightly on Monday, 73, 54. So there's your temperatures for the week. Have a lovely day today. We will be back again tomorrow at 9 a.m. You could always watch our rebroadcast at 12:30 and 5 daily, Monday through Saturday. Again, this morning at 9:30, if you are watching our morning broadcast, is the town hall meeting, so stay tuned for that. All right, have a great day in the village. We'll see you again tomorrow. Bye-bye.
Love that ring. Where'd you get it?
I got it at the jewelry box. I saw it on Facebook, and then I went in and bought it. They have the most unique, awesome pre-owned pieces for amazing prices.
The Jewelry Box of Lake Forest, voted best jewelry store in Orange County for 8 straight years, offering unmatched prices on fine jewelry and watches, refurbished to new condition.
Visit us in our store or shop our website for just arrived items.
The Jewelry Box. It's about trust.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.